So, burnout isn't just a personal problem, it's a silent system failure, one that costs billions, erodes lives, and threatens the future of work. If you think resilience is the answer, you are only seeing the tip of the iceberg. I am Dr. Sunil Kumar. I am a lifestyle medicine physician, anesthetist, and a burnout prevention coach. For over a decade, I have worked with doctors, nurses, entrepreneurs, and leaders across the healthcare and corporate sectors. I have seen what's often hidden behind polite smiles and packed diaries, which is chronic exhaustion, disconnection, quiet suffering. Not because people are weak, but because the systems we work in are sick. Today, I want to show you what burnout really costs to our health, our economy, and our humanity. Burnout was officially classified by the World Health Organization in 2019 as an occupational phenomenon, not a medical condition. So it results from chronic workplace stress that has not been successfully managed. Gallup's global workforce study found that 76% of employees experience burnout at least sometimes, and 28% feel burned out very often or always. This is not rare, it's routine in healthcare. Burnout is directly linked to 2 times increase in patient safety incidents, higher medical errors, and lower patient satisfaction scores. Now, this has come from the Mayo Clinic proceedings and National Academy of Medicine. In the corporate world, burnout manifests as high turnover presentism, which is being at work but unproductive, quiet quitting, and then the talent drain in key leadership roles. Burnout is a silent saboteur of performance, especially in high stakes, high output roles. So, what is the real cost of burnout here? Let's talk money. Globally, burnout costs the economy over $300 billion annually in absenteeism, healthcare costs, reduced productivity, and turnover. Now, this is from WHO, Deloitte, Harvard Business Review, the information which I gave you before. In the UK, the NHS loses over $3 billion a year due to stress-related staff absences. For corporates, losing a mid-level manager due to burnout can cost 150 to 200% of their annual salary to replace. This includes recruitment, onboarding, training, and loss of institutional knowledge. But the real cost is not the money, it's human. Burnout has been linked to 40% increased risk of developing depression, sleep disruption, and hormonal dysregulation, along with higher cardiovascular risk and even premature mortality in extreme cases. So, coming back, it's a system problem. Here's the hard truth. Burnout is not a sign of personal weakness. It's a sign of a system failure. Too many organizations try to fix burnout with yoga classes, resilience webinars, or a fruit basket on Fridays. But when workloads are unsustainable, leadership is reactive, recovery is undervalued, and purpose is missing, no amount of mindfulness can undo the damage. We must stop treating burnout as an individual issue only and start addressing it as a systemic design flaw. The National Academy of Medicine refers to burnout as a moral injury, when professionals are unable to meet their calling due to broken systems. So it's time to adopt a systems thinking approach to well-being that includes culture change, leadership accountability, workload recalibration, recovery integration, purpose, and meaning at the core. That's why I developed a PREP framework, P-R-E-P, PREP framework, a 4-phase model designed to help individuals and organizations address burnout sustainably. PREP stands for Prevent, Rewire, Elevate, and Perform. It's more than a coaching model, it's a culture reset. What does prevent mean? Prevent means understand the root causes, redesign the workload, and build protective habits. What does R mean? R is rewire, address cognitive and emotional patterns keeping people stuck. Elevate, shift the environment to foster meaning, connection, and autonomy. And lastly, the P, perform, create systems where sustainable high performance is the norm, not the exception. This framework is backed by behavioral science, positive psychology, and organizational leadership research. And I have used it to coach doctors, managers, and teams to real transformation. So, burnout is the symptom, the system is the root cause. Whether you are a team leader, a healthcare provider, or a CEO, you have a role to play in reversing this crisis. If you are ready to make a change, start by assessing your system, not just your people. So join our upcoming Burnout to Balance Reset program or download our free burnout cost calculator to see what's the costing your team. Because the cost of ignoring burnout is one we can no longer afford. Thank you for watching. Let's build systems that support health, not erode it. Because thriving organizations start with thriving human. See you in the next video where we dive inside the PrEP framework and how you can apply it to your life or workplace.